this is Dr. Frank Patterson here. I'm going to be talking to you today about strabismus in children and adults. It presents a little bit differently in those different populations. But a little bit about myself. I'm one of the staff doctors here at Georgia Chiropractic Neurology Center. You can see I've even got my t-shirt on today. We are Georgia Chiropractic Neurology Center. We're a chiropractic neurology clinic, meaning that we deal with functional neurology, aka chiropractic neurology. So we're treating all kinds of complex neurological disorders. And we do it a little bit differently from everybody else in the neuro rehab space, based upon our knowledge base and our extensive training and certifications. So a little bit about what we're going to be talking about today. We're going to be talking about what is strabismus and how does it affect vision. We're going to be talking also about strabismus in children, the causes and the signs, and strabismus in adults, the causes and the signs and symptoms as well there. We're going to talk about the typical diagnosis and treatment and how our clinic can help you specifically, because as I said, we do things a little bit differently. A little bit different that yields really good results for our patients, because we get a lot of patients that have tried the typical things for strabismus and just aren't quite making the progress that they want. So what is strabismus? Strabismus, also known commonly sometimes as crossed eyes, although that's a very simplified way of looking at it because strabismus can present in different ways, but strabismus is when the eyes do not line up in the same direction. So one eye may look straight ahead, okay, while the other turns in, out, up, or down, okay? And I'm going to be using my hands a lot. Maybe we'll do it like this, but these are going to be my eyes. I'm going to use these during our talk today. So one eye may be looking in a different direction from the other. Sometimes they're both heading in different directions than they should be. But there are 6 small muscles that control each eye, and they are on the outside of the eye, and they help control what direction things are pointed in. For clear single vision, all of them must work together so that both eyes aim at the same target. Okay, the misalignment can be constant or it can come and go, and we're going to talk about that a little bit more. And it can even switch from one eye to the other. It's good to know that approximately 4% of people experience strabismus at some point in their lives, whether it's in the children or the adult populations. Okay, so the main types of strabismus, it's usually described by the direction of the eye turn. So we've got our 2 eyes, right? And sometimes I'm going to talk about these as cameras, and we'll get to that in a little bit. But with an esotropia, one eye is pointed inward. With an exotropia, we've got an outward pointed eye. Okay, with a hypertropia, one of them is pointed upward. With a hypotropia, one of them is pointed down. Okay, so it's sitting lower than the other eye. So you want to look at the position of the eye, look at the positions of the pupils, that black part of the eye, and look how it is relative to the other one. Sometimes it's very noticeable, sometimes it's very subtle as far as these directional misalignments. But even with the very subtle ones, it can lead to big problems for people, whether they're in the child or the adult population. So how is vision affected when we get these eye misalignments? Normally, the brain blends the images from both eyes into a single 3D picture. So I talked about camera 1 and camera 2, right? We've got camera 1 and we've got camera 2. Okay, and they are both looking at the same target, hopefully, if they're working pretty well together. We may bring them together if we're looking at a closer target, or keep them pretty straight ahead if we're looking at a target far away. But either way, we want both eyes pointed at the target that we're looking at, okay? And that's going to be able to help us judge depth. It's kind of like if you go to a 3D movie. If you've ever taken off the glasses at a 3D movie, you'll see that it's almost like there's a couple images there and they don't quite line up. Those glasses help those 2 slightly different images line up that are positioned slightly different, and then it creates depth. And our eyes do that as well. They are pointed pretty much in the same direction, one eye versus the other, but there is a subtle difference, right? I mean, one eye's over here and the other eye's over here. It's not like they're both in exactly the same position. So, with these subtle differences from camera one and camera two, our brain puts that together and then we get depth. And the problem is if we're only looking out of one eye, that could be helpful in preventing double vision that we get sometimes if one eye is pointed in the wrong direction. But we're going to lose out on that depth unless we're using camera one and camera two. So, in children, the developing brain often ignores the weaker eye's image to avoid confusion, and that can become problematic, right? So this child is developing their vision in the first place, okay? Once we hit about 4 months, we want to make sure that those eyes are pointed in the same direction when they're looking at various targets. It's okay if they come together sometimes when things are getting close to them and they're tracking a close target. But we don't want the kid, staring way off in the distance and their eyes are crossed because they should be looking at a far target and their eyes should not be crossed. Okay. But the problem is the brain is going to process those two images. Okay. And it's probably going to see double if one of those eyes is pointed in a different direction. So what it's going to do is it's going to shut off one of those cameras so that it can just see one thing. Okay, and if we do that for too long during the developmental period, there's very limited windows of time where we train our brain to be able to see through both eyes. So we want to get that vision corrected kind of as soon as we can, because if we miss that developmental window, it's going to be really difficult, if not impossible, to get that vision back, right? Because the brain is trying to shut off vision from that camera that's pointed in the direction it doesn't need to go in. Okay, and then overall too with that over time you're going to have persistent weakness of that eye, meaning weakness in the muscles that are supposed to point it in the right direction, and it's just going to point askew, and then that can be tougher to fix at a later date. Early intervention is best, as it is with a lot of the things in the neurology world. With adults, the brain has already learned to use both eyes and cannot simply ignore one. Okay, so if it's something that developed in adulthood, like childhood, you're looking real good, and then adulthood, something happens, and then one of these eyes starts to point in a different direction, you're going to get double vision. Okay, you're going to see two images, and one of the ways we'll check on that is we'll cover up one of the eyes, and this is what's called an occluder, and you can't really see through it, and we'll cover up one of the eyes. Okay, so let's say we've got this misaligned eye that's pointed inward. Well, we'll go ahead and cover the other eye. And now you're primarily looking out of the misaligned eye, and that may help it to go back in the position it needs to be in. And then I'll uncover the quote unquote good eye, and then this thing pops back in. Okay, that's one of the scenarios that can happen. And that's one of the ways we can figure out what's going on with a person's brain that's leading to this issue. Okay, so different reasons why we could get a misalignment. And let's dive into that a little bit more. With strabismus in children, most strabismus appears by age 3, but it can start later in life. Sometimes there is no clear reason. It can happen on otherwise healthy children, but common things that can go along with it include focusing problems. Uncorrected far or nearsightedness may lead to strain, and glasses can often help. Okay, you may have a family history of strabismus in a parent or a sibling, and that kind of increases the chances that you too may also have an eye pointed in an askew direction as a child. Premature birth can be a factor. Neurological conditions such as cerebral palsy or hydrocephalus, Down syndrome. It's more common in children with Down syndrome, or there could be a cataract or an injury to the eye that leads to a clouded lens, and then the eye just kind of loses its focal point. Okay, so that's with children. So things to watch for with children is you want to make sure that the eyes that point in different directions at the same time, you may see that. One eye that turns in up or down. So you're looking for that eye alignment issue. If that's tougher to see, you may just more so notice squinting or closing of one eye, especially in bright light. You may see the child tilting or turning their head to look at something because sometimes an eye is out of alignment. So you'll turn the head to bring them both in alignment. So if I have one eye, sorry, I'm kind of working backwards here, but if I have one eye pointing in that direction and this eye is pointed straight where it should be, sometimes we'll turn our head to get both eyes pointed where it needs to be. And we'll do that subconsciously. And we see that in both children and adults, where we'll see a tilt or a turn of the head to try and line them up. So, once again, you do not want to wait and see how it goes. Children do not outgrow a true strabismus, and it can get worse without care. So, any child older than 4 months whose eyes are not straight should be examined. Okay. And it's, you may see a little bit of an alignment issue before that age, especially if it's something that you've only seen once or twice and you're not even sure if you've seen it. It's not something to panic about. But if it's something that you've seen pretty consistently, right, all the way up through 4 months of age, like you want to get that checked out. And untreated, about half of children with strabismus develop what's called amblyopia or a lazy eye. It's a more persistent condition. Okay. So the earlier treatment begins, the better. Strabismus in adults, it can be carried over from childhood, right? Leading to that amblyopia that we talked about. And it may become more noticeable with age. Sometimes we're fine and we have great eye alignment, but then we have an injury to our brain, such as a stroke, vascular or other vascular issues. Could be a traumatic brain injury. Could be thyroid disease, such as Graves' disease, diabetes, or you can get nerve palsies that actually affect the nerves that affect some of these eye muscles that we discussed. So there's different cranial nerves, the third, fourth, or sixth cranial nerve that are involved with those are the nerves that innervate, right, or control those eye muscles that help move the eyes into the positions that we need to move them to, but also hold the eyes in position so that they point in the same direction. And sometimes there's damage to that nerve, or sometimes there's damage to that brain center, right, called the nucleus, where that nerve arises from. Sometimes, though, it's a more transient thing, okay, and it's how the brain is interpreting the world and how it's reacting to it, and it's not sending impulses through those nerves appropriately. Because there's some miscommunication in the brain, essentially. And that's where we specialize. That's one of the things that make us different, because with a lot of practitioners that are more stereotypically working with people, such as like vision therapists, or there's some physical therapists that do aspects of vision therapy, or optometrists, they're primarily concerned with the muscles that are involved. They may, identify one of these nerve palsies, but as I said, sometimes something presents like a nerve palsy, and nerve palsies usually are very difficult to treat. But we've seen patients where they've had just issues with how their brain is functioning, and it looks like a nerve palsy, but it's not a true nerve palsy. And we're really good at differentiating that. Whereas it's people that don't have as much training in the brain and how it works and how it interprets things, they're going to miss those more functional issues with the brain. But we're going to talk about that a little bit more. And there's another disease called myasthenia gravis, and at times a brain tumor as well. But just because you see a misalignment in the eye, it certainly does not immediately mean tumor, okay? Symptoms in adults. Here's a tip for you. If double vision disappears when you cover one eye alignment is often the cause. Okay? It's way less common to have double vision in either eye. So I have double vision. I still have double vision. I still have double vision. We're talking about a different thing. It's less likely that eye alignment is an issue there. That can be a lot tougher of a challenge. It's a visual processing issue. However, our clinic is really good with visual processing issues as well, and we see a lot of patients with those, even though they're much less common. But the reason why they're kind of more common in our office is because there's not a whole lot of people that have good answers as far as being able to help with those issues. Symptoms can be constant or come and go. All right. So that's important to remember. So symptoms in adults: misaligned eyes, eyes that visibly point in different directions. Same thing with a kid. Loss of depth, reduction in depth perception. You may notice that, yeah, like I'm seeing things and it's tougher for me to judge depth. You may also have some double vision where you see two of one image. It could be that you see like two overlapping images, right? It could be that you see two kind of sort of connected images or two very different images, right? I know that there's one fist here, but I'm seeing this, or I'm seeing this, or I'm seeing that. And the direction that you're seeing this skew can help us also figure out where that misalignment is with your eye. So we want to use that diagnostically as well. But anyway, eye strain is another sign that maybe you've got some strabismus. Okay. Pulling sensation or fatigue around the eyes is eye strain. Blurred vision, right? Or difficulty reading. Head turning. Once again, same thing as with the kids. Like everyone's like, hey, you have to like tilt your head all the time to the right. Like you didn't used to do that. Sometimes we'll look at people's driver's licenses, especially if it's a little bit older driver's license, or we'll look at old family pictures and we're trying to look at, does this person still have the same head tilt, right? Are their eyes better aligned in their picture than how it looks currently? Important things to consider. So children versus adults. Once again, with children, it's also the brain suppressing the weaker eye. That's a concern. Now with adults, the brain cannot suppress one of the eyes, and we got double vision, also a concern. Okay. Main risk with children is amblyopia or a lazy eye. It's usually painless. Double vision is not as common with children as it is with adults. Early treatment protects developing vision, though, right? Because we don't want an eye alignment issue with a child and the brain's like, all right, I'm cool. I got this. I'm just going to look out of this eye. Okay. That's not great because we're going to lose that depth perception. The world is not going to look quite the same if we're just looking at it through one eye. Plus, unfortunately, things happen in people's lives, and it's good to have two eyes because, yes, sometimes something happens and somebody loses an eye. All right, but if you got an eye alignment issue, like plan B is already gone. All you got is plan A. You don't have that backup. So we definitely want to make sure that we're not losing vision in an eye in a child, right? Due to one of these eye alignment issues, because the brain is just trying to keep from seeing double. So it's just going to shut down processing for the one eye. And there's a window of time where we can lose that processing, that ability to see out of that misdirected eye on a more permanent basis. Like, yeah, great, we don't have double vision. But if we can fix that alignment, we're not going to have double vision anyway. And we're going to be able to see out of both eyes. We're going to have depth perception, and we're going to have a plan B if we injure one of those eyes. So a little bit more with adults. Often signals an underlying health issue, right? There's usually something that caused this. It could have been a stroke. It could have been a brain injury. It could be myasthenia gravis, right? We want to take it seriously as well because, like, how did we wind up here? Like, there might be something else going on that's really important for our health as well. It can affect driving, reading, work, and confidence. And it is treatable at any age. Also important to note, you got a lazy eye as a kid, you missed that window, you're an adult now, you're like, oh, what am I going to do? Like, there's still things that can be done. It would have been easier as a kid, but there's still things that can be done as an adult. Diagnosis. So you're going to want to get a thorough eye and vision exam as a starting point. Okay. And you're going to want to get an assessment of how the eyes line up and move So one of the things we'll do, I'll use my little cell phone here, is usually we don't use a light as bright as this, but I'm going to shine a light up towards people's eyes, and I can see where that dot of light is, and you can see it on the picture in the slide here, where that dot of light is on the slide. And you'll notice it's the patient's right eye, but it's the left eye for you in the top part of this picture. You'll see that that little white dot that's supposed to be the light is pointed on the outside, the brown part of the eye, right? The iris. Whereas the other dot is pointed nice in the middle, okay, of that dark black pupil there. Okay, so you look at the top person in this picture and you're like, ooh, they've got an ESO eye. It's pointing inward. And then this is what's called a cover test. You use one of these occluders, and then it's like, hey, wait, when I cover the good eye, the pointed inward eye pops out. Interesting. That's probably the eye that's pointing in the wrong direction, especially if you're telling that patient, hey, look straight at me. And they are, but only with one eye. Okay? So you want to do an assessment to see how the eyes line up and move. So it's like watching how light reflects on the eyes, and the cover on cover test, which we're going to talk about a little bit more, although I started to talk about it. And you want to see if you can get a measurement of the degrees of misalignment. You also want to look at near and farsightedness. Okay, just getting a good examination with an optometrist, essentially. Okay, and you may want to see somebody that specializes in strabismus and works a lot with what are called prism lenses. Okay, because those can be a helpful tool when trying to fix this. And with a new adult case, you definitely want to get some blood tests, and possibly some imaging, such as an MRI as well, to figure out the underlying cause, right? Because with kids, it can just happen this way. Although there's some other things like cerebral palsy and Down syndrome, but with adults, it's something happened. Something definitely happened to cause this. We want to figure out what that is. Okay, so how do we check the eye alignment? Once again, we're going to test the corneal light reflex. That's where we're shining the light in the eyes, okay? And we're looking at where that little white dot appears, like I was just talking about. And it's relatively painless. It's a little bit of bright light. There's the cover on cover test, okay, where we briefly cover one eye and then uncover it. And we want to see how these eyes move, right? And then there's also the alternating cover on cover test, or the alternating cover test. And we just move kind of rapidly back and forth, okay? Because sometimes when we do it slowly, it's tougher to see. We don't see as much of the change. It's not as drastic. But when you do a more rapid back and forth, it brings out the full misalignments of the eyes, because you don't have as much time to fixate that eye or one of those eyes on a target, because you're rapidly going back and forth. So you can't have that one eye dominantly looking at the target. It's got to rely on both. And when it's relying on both and one's already weak and it's pointing in the wrong direction, it's going to bring it out more. And then you can use prisms to look at different angled prisms, and that can help you refine how many degrees off. And to a certain extent, we're dealing with a certain level of prisms with these glasses that we use here. And then we can turn this and figure out, different angles as far as misalignments with the eyes, okay, with these cool glasses, okay. And we can also do what's called a Maddox rod test, where we cover the eye and then we shine some light in there. And depending upon how the light is reflected in here, it'll help us to know how far the eye is out of position. Okay. And then, hey, it's like, all right, it was way out of position. Now it's getting closer and closer to where it needs to be. And we can track progress with this too. So it's great. So conventional treatment options. There's glasses like I spoke about, and with glasses, they're going to use prism lenses. And with those prism lenses, it's going to bend the light to head towards the eye, It's going to help coax the eye outward. Okay. A lot of times with babies and very young children, they're going to use some prism lenses, and you're going to see the kid with the glasses on, right? And they're going to have the head strap on the back because they want to keep that thing as long as possible. And yeah, the prism lenses are these wedge shaped lenses that bend light to merge the two images, right? To help with double vision. Okay. With those prisms, it's going to be really helpful with like an adult where because the prisms, if you use them a certain way, you can help redirect the eye. Sometimes they're used and it's like, we're just going to give up on redirecting the eye and we're just going to point vision in the direction. It's like, hey, you want to point inward? We're going to point light in towards that way. We're going to point the picture that way towards the unaligned eye. The only problem with doing it that way is you're just reinforcing like, hey, I must be in the right position, right? If I can still see through these glasses. So I'm just going to get really good at staying in this position. So sometimes it's helpful to do rehab without those glasses on because we don't want to be reinforcing being in the wrong position. Vision therapy can be great. Those are going to be different structured eye exercises to build in coordination, right? To strengthen those muscles, okay, as far as getting the eyes in proper alignment. So you might do like visual tracking exercises. You might practice like converging or diverging your eyes, right? Converging or diverging. The target's getting closer to you, your eyes are converging. It's getting further away. The eyes are diverging. We might patch one eye, right? This is this eye on this side. Here we go. Trying to get used to the camera still. This eye on this side is seeing kind of funky. So I cover the eye on the other side. This is the funky eye. This is a good eye. This is the funky eye. Cover the good eye. The funky eye that was pointed in the wrong direction, whoop, starts working if we still have good vision coming out of that eye. So sometimes we'll do eye patching exercises, and sometimes you'll see that with a vision therapist as well. Sometimes they'll use Botox and injection to relax an overactive eye muscle. But typically the effects of that are temporary. Sometimes it's lasting, but oftentimes it's temporary. And then some people will do eye muscle surgery. Like, so if the eye's pointed in the wrong direction that way, it's like, all right, let's lengthen that one muscle to allow this thing to come out. But part of the challenge with that and the Botox is that oftentimes it's not an issue with the muscle, especially when you're looking at an adult. It's like, hey, I was cool until I had a stroke, and then now my eye's out of alignment. The stroke, chances are, did not affect that eye muscle. It affected the brain, okay, that controls that eye muscle. The brain that sends signals through the nerve to the muscle. So just Botoxing that muscle or having that surgery is not really going to fix the problem. You get that part of the brain working better, that eye can align. And part of the way to do that, maybe with like some vision therapy stuff, but also having an understanding of those areas in the brainstem where these nerves come from. But those areas in the brainstem that control the nerves, that control the eyes, they talk with other areas of the brain. And if there's an issue with another area of the brain, it can lead to areas in the brainstem that lead to issues with the nerves control of those eye muscles, and then it leads to a misaligned eye. So it can be pretty complex when we're talking about the neurology behind vision or visual coordination. So aiming eyes both at the same target is not only about eye muscles, it's a whole brain job, like I just described there. Strabismus can begin anywhere along this network. So there's those cranial nerves, 3, 4, and 6, that send commands to the eye muscles to tighten or loosen, to point the eyes in different directions. Okay. And there's brainstem gaze centers that coordinate both eyes as one team. Okay. I want them to point together, not like this, right? Point together. Your cerebellum helps fine tune the movements of these eyes. The frontal and parietal eye fields direct attention and shift your gaze to different targets. Sometimes there's issues there. Usually the eyes move together, but my hands can't move together for some reason. Okay. Um, there's also inner ear vestibular input that helps stabilize your gaze when you move, right? I'm still looking at the same target, but I'm moving my head, but my eyes stay on target, and my vestibular system helps with that. And then there's your visual cortex that helps fuse images into one 3D picture. Okay. Anywhere in here, you could have a brainstem issue, you could have a cerebellar issue, you could have a frontal parietal issue, you could have a vestibular issue, you could have a visual cortex issue, and you could wind up with strabismus or some kind of double vision. Got a patient I was just working with this week. He sees not just two, but he sees like multiple extra targets. Okay. He's got a visual processing issue. It's more an issue with how his visual cortex is working. So we got to get better processing out of that. Okay. It's not even so much an eye alignment issue for him. There's a lot of different ways that you can have this double vision. There's a lot of different ways that we can get these eye alignment issues. Now, if you're working with a good vision therapist, that can be helpful. If you're, some Botox could be helpful, some prism lenses could be helpful. But all these practitioners are not really addressing these areas of the brain that we just discussed here. So they may miss that, and they may be able to help so much. And oftentimes that's what we see with our patients. But we're often able to take into account more the root cause of what's going on, the brain's control of these muscles, and in turn, control of the eyes. And we got some really good results for people as far as helping with their double vision. Or we've got that kid where that eye's out of alignment. We don't want them to lose vision in that eye, and we're able to get things better lined up, right? And these people are seeing much better. And it's really cool when it's in a kid too, because it's like, wow, the whole rest of their life is going to be very different in a very positive way. So, a different approach, brain-based care, right? Typical strabismus care, like I said, glasses, prism lenses, patching to strengthen or weaken an eye muscle surgery. Attention stays mainly on the eyes and their muscles. With us, with a functional neurology or a chiropractic neurology exam, we're going to figure out where the breakdown is in the brain, in the nerve, and in these muscles. We're going to retrain these eye movements, and we're going to focus on eye movements, focus, and balance, all things that can influence these eye movements and functionality of the brain. And we're looking at whole systems too, whole system tools. We're looking at the person as a whole. We're looking at sensory motor integration, meaning we're looking at how head and neck position are involved with this, the senses that are coming from that, and the movements that go along with that inner ear processing, right? Sometimes we use vibration therapies, or there might be some vagus nerve therapies that can be done as well to help. All different types of therapies depending upon which area of the brain we're trying to hit with that stimulation to get things back on track and processing better. And we're going to give you a personalized plan and coordinate with your eye doctors, of course, because a good place to start is with an optometrist, like I talked about earlier. But there's a whole lot that we can do with brain rehab to get this better. So, once again, we focus on how the eyes, brain, and body work together, and we build a plan around you. We're going to give you a comprehensive evaluation of eye alignment, how your eyes move. We have high-tech video nystagmography goggles that track the movements of your eyes, whether it's a tracking eye movement, whether it's eyes jumping from target to target, right? Look over here, look over here, look over here. And then we're constantly looking at that eye alignment as well. And we get some good graphs and some good data to be able to track that progress, right? A lot of our patients come see us too because they want to try and avoid that surgery. Sometimes the surgery is necessary, especially in the kids, because we've got that limited window that we want to hit. And we want to hit that window, and sometimes the surgery is the way to go. But there's so much that can be done before we get to that point. with neurological rehabilitation exercises or neuro rehab exercises. So we can help with symptoms like double vision, eye strain, or difficulty reading. All right. So remember, it's never too late to treat strabismus. It's common and treatable at any age in children. Early care protects developing vision and prevents lazy eye. And adults' new double vision deserves a prompt check. We don't want to have to live with that double vision. We want you to be able to see single again and get your life back. So glasses can be a good part of the mix, but also neuro rehab. Okay. Botox could help. Sometimes the surgery is necessary. But let's start conservative first. Let's do some neuro rehab, get your brain working better, get to the root of this issue. We're happy to help. Thank you so much for your time today. I appreciate it if you stuck all the way through with me. We're happy to do a complimentary consultation and talk to you about how your double vision or your strabismus or your eye alignment issues, your eye strain is affecting your life. And we're going to talk to you about how your brain could be at the root cause of this. And we're going to figure out the right place for you. You know, sometimes we have calls with people and they need to go see the eye doctor first, or let's by all means work with you. But we also, want you to get some consultations with some other doctors as well. We're going to point you in the right direction. At the end of the day, I just want you to get better. I think we can be a key component to this. So let's start with a complimentary conversation. So anyway, feel free to reach out. Thanks again for spending some time with us. Please look through our library of other videos, because oftentimes, if you're an adult and you're dealing with these eye alignment issues, we've got some more information about other things like stroke. We're producing content all the time on the different conditions we work with. You may have some other neurological disorder. Chances are you do if you're an adult with one of these eye alignment issues, and sometimes that's the case with kids too. But looking forward to speaking with you, and thank you again.